Jeanette, I'm so sorry. All I can see is iPhone on the name.
Yeah, you'll have to excuse the echo.
It's not bad. I don't hear one.
Okay.
Okay, John, you're live.
All right.
Hello,
everybody.
I'm moving my health department today. So
look at you on the top of Christmas week. You're doing that and joining us. Thank you for creating the time. I want to welcome everybody here to our second installment of Regional Report Out. This is the week of December 22nd, and we will be here every Tuesday for the next few weeks at 4 o'clock Central Standard Time for you to know what's going on in your region. This is an effort of the state of Kansas, letting you know what's going on regionally with your healthcare system. Bipartisan effort. We're going to change up the format a little bit this week. I'm going to put up the dashboard that the Kansas Hospital Association provides for us. We're grateful for their partnership and work. And then we'll pivot to public health to give us an update and color from their perspective on those numbers, and then to the hospitals also to be able to do that. And then we'll focus the end of our call around the idea of transfers and how that process works. Our friends from Cheyenne Mountain Software, who runs the Mission Control app, will give us an idea of what's going on with transfers and the data that they see and use, and how that plays into how the healthcare system flows. So let me just say, hey, if you want this emailed to you every week, the call after it's done, along with the dashboard, go to covid.ks.gov/report-outs. That's covid.ks.gov/report-outs to let us know. I also encourage you, if you have feedback or questions you want us to discuss, ksregionalreport@gmail.com, ksregionalreport@gmail.com. We've gotten good feedback also in the past week on that. So let me share my screen here for everybody. Oh, I need the ability to share my screen if I can, Megan. If you can make me the host. Okay, there we go. All right, everybody. If I can get some head nods, if you guys can see the dashboard. Does that work? Okay, perfect. So here's what you're seeing. This is what will get emailed out. It's also on the website for you to look at yourselves. In the Southwest region, there's 18 hospitals reporting. These regions, again, were established by the Healthcare Coalition of Kansas under KDHE. And so you see the 18 hospitals here. And we ask, how many of those hospitals are anticipating staffing shortages? As we've said, when hospitals get in trouble, it's usually around staffing, stuff, or space. Staffing's been kind of at the top of that list here over the past couple months. So you can see 39% of the hospitals are anticipating staffing shortages this week. Then you can see a little bit about the COVID census count there in the hospitals in your region. And then we move over to ICU beds and ventilator availability. Fortunately, you can see ventilators, not an issue right now. You have 7 patients on ventilators in your region. 60 available, which is good. But here's where you start to see a little more concern in the Southwest region. Only 3 staffed ICU beds available. That's 15% of that total capacity. And this is a dynamic number. I just want you to know and understand these. We have to pick a point in time to produce these sheets, but they change by the hour and by the day, and depending on the hospital, and as patients are released or moved around the hospital. And so you can see that number there for this week in the Southwest region. Now, on the better news side, and there's only 2 regions that have a graph that looks like this. The Northwest region too. So Western Kansas has been doing a nice job, where you could see that the number of cases per week in your region was right around 500, and into November that really spiked up to 12, 13, almost 1,300 there. And now we're seeing that start to come back down here, 603 this past week. Not any reason to become less vigilant. It's a sign that the vigilance is working. Any steps people are taking individually, if they can keep doing that, it obviously impacts the community. But a lot of places in the state, just so you know, have come up to this level and more or less plateaued in their number of cases. And we're all kind of on the edge of our seat wondering if what a post-holiday spike might look like. So that's what we're doing for the region there. Then on the second page of the sheet, you can see just the percent of the county that's tested positive, the county population. in your region, and you can also see the what's going on with the ICU beds in your region. How many are COVID? How many are non-COVID? Because there's always the non-COVID stuff still going on: the heart attacks, strokes, the car accidents of people who need that critical care. And as that critical care gets more needed, people move from the critical access hospitals in the rural part of the state to the regional hospitals, and then as that goes, they move into generally the major metros, and that's why we'll be focusing on the transfer data. Okay, so that's where we stand. As we speak right now, Jeanette is moving her offices today. We know she's already busy, and it's a holiday week. If we appreciate you giving us a little time, but is there any color you want to provide around what you're seeing in the region and in your area from a public health standpoint? And you're muted too, if you can unmute. Thank you.
Thank you. I did reach out to my regional partners, and many of us are starting to get the COVID vaccine this week. And, using the priority list from KDHE, we are starting to get it out to health department workers, EMS, other health care workers that may not fit in the hospital setting. Many counties are, seeing a decrease in cases like you showed on your graph. But we do fear, the increase of cases after the holidays. So we are also working with Well Health in many of our counties to get testing sites set up so that we can increase our testing capabilities across the region. So we also have very many residents from our county calling and asking for the COVID vaccine, whether that be those that have chronic conditions or are the elderly. They're just wondering how soon they can get the vaccines. So many of us have started a list and tell these, patients, residents, that we will contact them as soon as the vaccine is available for public use. So that's pretty much all I have.
Perfect, Jeanette. Thank you. And there won't be a whole lot more about the vaccine on this call if there are people tuning in for it. It's been a much needed injection of hope into the frontline workers. We've had Pfizer and Moderna both out. To give a little color around that, the Pfizer vaccine, you get your first shot, 21 days later, you get your second shot. And then it's 2 weeks after that you're considered immunized. Moderna is a 28-day window between the two shots. So it's 5 or 6 weeks from the time someone gets a shot before they're fully immunized. And, they're producing, it's been a magnificent effort to get the vaccine found and produced and beginning to roll out at this point. But there's not even been enough shipped to Kansas yet to cover all the frontline workers yet. But we do know we're getting more every week. And as we have information on that, this will be a place where we'll share information about how that process will work. So continue to tune in to these regional report outs and we'll get that data to you. Let me pass it over to Mary. Well, let me say one other thing too. If you're wanting to get tested also, which is an important thing, there is a website called gogettested.com. Remember, gogettested.com/Kansas. You can find the testing sites in your area if you want to go see what's going on with yourself. Okay, Mary, let me pitch it over to you.
Sorry, I was muted. Good afternoon, everyone. My name is Mary Adam. I'm the director of the Pioneer Health Network. We're a network of mostly critical access hospitals, 3 larger hospitals in Western Kansas. For the purposes of this call, I represent 18 of our members in the Southwest region. As far as the COVID numbers, as John indicated on our dashboard, they seem to be leveling off, going down in most counties, but also, as John said, those numbers are fluid and they change from moment to moment, especially with the upcoming holidays. Staffing challenges, which continue to be a problem, but they have improved. Our hospitals have some staff that are returning to work because they're off of quarantine or from illness with COVID. But again, that can change from minute to minute as well with increased admissions. One thing that I'd like to bring up is our hospitals with long-term care units. These units in the freestanding nursing homes continue to face huge challenges in their staffing and their requirements for testing when they've had a positive resident, and just caring for the patient, the residents, for their emotional and physical needs. They are a big piece in this puzzle of COVID that we're dealing with in healthcare. PPE, I didn't hear any concerns other than, just some things are getting a little bit short, masks and N95s, but we're still okay. We are seeing, at least in one of our hospitals, one of the larger ones, they say they're seeing a seasonal influenza and RSV uptick in the local population. And RSV is a viral pneumonia that occurs in young infants and pediatrics, and it can become quite critical. And there have been some years when it becomes rampant as well. So that's another thing that we're dealing with in these winter months, in addition to influenza and COVID. And then another interesting thing that I got from one of our hospitals, and I'm just going to read this. They've had a increase in unattended deaths in the county, with coroner's cases being about double what they were this time last year. Not sure if this is actual COVID and how much is delayed medical care due to the pandemic. So that being said, I want to encourage all of you to if you're ill, please go to your hospital, go to your physician and be seen so that you can be helped. The vaccine has rolled
Mary,
out.
let me highlight that just real quick. It's
Okay.
a great point that you bring up there. They call it the secondary pandemic, and that is people who literally have heart attacks or strokes but are afraid to go into the hospital. So you see the emergency room numbers go down, and people delay the care. That they acted faster could really help them. And you need to know those hospitals now, your critical access hospitals, your regional hospitals, all have taken great measures to be a very safe place for you to go to if you have non-COVID issues. And so I just want to encourage you to go in, because that is a significant health risk for folks. So thanks for bringing that up, Mary. Go ahead and finish.
I agree that hospitals may not seem like the safest place to be if you're ill, the safest place to go. But as John said, they are one of the safest places to go if you're ill. They have infection control protocols paramount to anywhere else. The vaccines have been rolling out. We have had at least one hospital that says that they were concerned with the vaccines, when and where they were and how many they were getting. So they're just hopeful with the second Moderna that there's a little bit more communication along those lines as far as getting the vaccines to them, when and how many. I'm going to turn this over now to Tammy Hutchison for our ground report. Tammy is the Chief Nursing Officer at Kearney County Hospital in Lakin. Lakin is a critical access hospital located between Garden City and the Colorado line. It includes a lot of primary and specialized services, and they have acute care, they have long-term care, they have assisted living, they have rural health clinic. They have a realm of services available in a very small community, and are very proactive in the treatment of their community and the surrounding area. So Tammy, I'm going to turn this over to you to give a ground report from Lakin.
Thank you for asking me to join this group. Again, my name's Tammy Hutchison, and yes, we have ventilators, and we have vapor therms, and we have BiPAP machines. I've admitted 3 COVIDs just in the last 2 hours. So I'm up to 6 COVID patients. We have a lot. The 10 is the most I've had on COVID patients positive, but we have 15 providers and then several mid-levels. And we have a very busy ER clinic. We have we have 2 clinics in Lakin, and we have a clinic in Deerfield, Kansas. And we're looking at seeing 900 some patients a week. That's a lot for a town of 2,500. And so, like Mary says, we are very busy. I've really had to put together a process to help the providers during the time I'm here, when I'm gone, when I'm at home. So I call Mondays, Wednesdays, and Fridays to 11 different facilities to find out if they have ICU beds available in Kansas, Nebraska, Texas, Oklahoma. And I've done this now for 40 some years, and I've never had a waiting list for an ICU bed like I do. I mean, in Northwest Texas healthcare system, they have a 10-bed waiting list. And so you have to go on a waiting list to go into ICU. Biggest concern for critical access hospitals is how do we help the regional area out? St. Catharines, swamped. Can you take this patient? No, I can't take that patient, but during this pandemic, can you give me another patient so I can open up a bed for you? Those type of things is what we're doing. And what our mission here at Kearney County is to continue to help our neighbors. And our long-term care, we had to put a bubble up when we had COVID over there because it was in my dementia unit. I could not put them all in the hospital. But, this last week, I have absolutely no positives in my nursing home or in my assisted living. And that's a plus. I mean, we're wearing masks and shields and everything. And I have all 9 rooms, negative pressure rooms, set up for negative pressure rooms. And so it's very, very tiring, as Mary says, for the staff. We're all working overtime. We go sleep for a couple hours, we come back. We're doing 4 to 5 shifts. You can't find help in Lake, Kansas. People that want to come here have heard how great we are. We deliver 300 babies a year in this little hospital. So, and we have 10 different cultures that we take care of in Lake. And so that tells you a little bit about the transfer and what we're facing out here. But I look at that every Monday, Wednesdays, and Fridays. And then if they have any ICU beds open, then I will get that on to my providers so they at least have an idea. It may have been open 10 minutes ago and it may not be open now, but this is where we're at.
Tammy, you said you call 17 places. Is that the number?
I call anywhere from 11 to 15 places.
11 to 15. Holy moly. Okay.
Every Monday, Wednesday, and Friday.
They
know my name now.
Well, I'll tell you, Tammy, it's great to meet you. And you're just a great example of the people that are out there on the front line who just continue to accommodate and pivot and serve the human beings that are walking through your door and that you're caring for in your community and are your neighbors. So thank you for being a light and encouragement to all of us and for sharing your story here on this call. And it's a great pivot over to what the guys at Cheyenne Mountain Software are doing and Mission Control. So I'll pitch it over to Dr. Watson.
Great, thanks, and really incredible. I mean, I think we just amazed at the good work that people are doing every day, 24/7, and there's no holidays, there's no weekends. It's all the time. We look at the state in a couple broad brushstrokes. I mean, we try to get an idea of what the current status is. These are state data that we've reformatted. Blue is positive cases, hospitalizations in red, and deaths in black. But I think couple things here. We've never been at this level during the entire year for the number of cases and hospitalizations. And it's staying pretty steady, even though I think everybody feels like there might have been, a slight turn and we get a breath here. We get to recharge a little bit, but honestly, we're very close to the edge all the time. And I think we get pretty used to being there and working within that. But the system's still fragile, especially going into 2 holidays where traditionally we get together. The next one shows how we track availability for beds. We're very pragmatic. We are solely concerned with helping facilities find placement for their patients. And so we use 3 buckets: normal capacity, near capacity or case by case, and then full capacity or no availability. And I think the traditional senders or traditional receivers that would typically take patients, we're screening them twice a day just to get an idea of where might be openings in the system. Secondary facilities that are not traditionally receivers for a majority of patients, we still have contact with them and we're accessing them for beds as well. This moves patients both up and down the acuity chain, as well as then takes advantage of all the resources in the state to be able to maximize the number of beds that we have. There's a lot of people who are working, as Tammy talked about, in ways that we've never had to work before, just to make sure that Kansans are cared for. And it's an incredible effort across the state. We collect a lot of data from this, and it gives an idea, as John was saying, that it can be a very sensitive indicator to where hotspots are and how critical some of the areas are at any one time. And Jesse walked through some of the data that we pull off of here and talk about it.
Yeah, so this dashboard is updated every 2 hours direct from our database and pulls in data that we can then do analysis and assessment on. This data is available to any facility that's using Mission Control. And if there's any listeners or viewers on this call that would like to learn more or gain access, you can send an email to contact@shinemountainsoftware.com. The data we're looking at right here is the last 30 days. And this set of metrics here in this top left corner shows the number of transfers that have occurred, the median acuity score. We do acuity indexing on all the transfers. What's interesting is that just under 40% are COVID presumed at the time of transfer. They've either tested positive or presumed to have been exposed and positive. So that requires then different considerations on the transfer crews or sending and receiving facilities. And then of the total number of transfers, 35% needed assistance in locating a bed. And again, speaking to what Tammy called out, it's very difficult at times to find a receiving facility for a transfer. We can also look at this data across different working diagnosis, how that's moved by vehicle type, ground versus air modalities. And then we also get some time metrics here. And you'll see this median time from request to arrive at origin is the amount of time from when the request hits our database to when a crew is being marked as arriving on site. You'll see around an hour, or an hour 20, which is a bit higher. We normally like to see this sub an hour. Obviously, geography, topography, weather all play into those considerations. But what gets interesting is if we mark bed requested or bed assistance requested, that time jumps from an hour 18 up to 2:34, and that's a huge leap. And furthermore, if that's a COVID patient, and I look at COVID only patients, COVID false, which is identifying then, hey, non-COVID patients that are needing care, and again, looking for a bed, that almost is 3 hours. It's just extraordinary to see that kind of time metric. So the impact of the COVID surge is not just on treating COVID patients, but it's the availability of general resources, especially for the time critical diagnosis, the standard MIs, stroke, sepsis, and others. So Mission Control, we're working to make this available to every hospital in the state. Would like to be an extension of those hospitals' teams where we can do the calling, the legwork on their behalf. All decision-making authority on patient transfers obviously stays with the provider and with the hospital. Our job and our goal is to, one, be an extension of the team on the administrative work to locate both receiving facilities and vendors, but then also to provide this data back to hospitals so they can continue to refine and improve their care. Just to highlight some of the extraordinary things going on, looking at the Santana Hospital here, and then if we say bed requested, just as an example, we had a GI bleed patient, acuity 12, that ended up waiting close to 6 hours for that transfer before they were flown to KU, and ended up being a 2.5 hour transport on top of the 6 hours. Just extraordinary. And obviously working to continue to reduce those timeframes, but it is the nature of some of the saturation in the system. And we just tip our hats to all the critical access hospitals working to do their best in these situations, as well as the receivers who are going to great lengths to take in as many patients as they can.
Yeah, thank you, Jesse. And the reason we highlight this is it just helps point out what the system might look like as it gets clogged. And at different points it does. The higher acuity you have or severity of your illness, the more you need to move up the healthcare system chain. The major metros and those hospitals there have the training, the staff, the resources, the tools that you need, the more severity that there is, whether that's around heart attacks or strokes or COVID related things, et cetera. And so as you're starting in the critical access hospitals and needing to move up, if those major metros are clogged, then it pushes back and takes longer and longer, and you have to look out of state, as Tammy was talking about, and get further from home for your care. And so we're grateful that the mission control folks here are willing to share the data and help us see it. We'll have some data from them, I think, on a regular basis of what's going on in the region as far as the transfer times. It's an early indicator as the system begins to show cracks into what we're normally used to and the kind of care that we get. And so thank you guys for setting that up. Is there anything you'd want to add, Dr. Watson or Jesse, before I wrap up?
No, I think just encouraging everybody, continue the good work. I mean, it's a tough moment for all of us. Hopefully light at the end of the tunnel as we pass the first of the year.
Mary and Tammy and Jeanette, anything you'd want to add on this?
I just want to say last Thursday we set up in our dining room, in our classroom, and we got 55 vials to give the vaccine, and it was just unreal. The awesome experience in there, the personalities, and the wave in there. It was just like everything lifted. I mean, we had providers giving shots to us just because they were so relaxed that it finally is here and hopefully helps. And then they came in the next day and said, wow, wasn't that awesome? You could just feel the energy from everybody. So it's happening. It's happening, like Dr. Watson says.
Well, we can feel it from you and appreciate that energy and know how important hope and having an offensive tool in the toolkit against this virus has been. And you are a bright spot. Thank you for sharing that bright spot. I'm going to share one more that Mary had found and sent to me. It's I'll make sure I say the Satanta. Is that the right way to say it? District Hospital. They were just working with people and recently, Joan, Pat, and Travis Rupp of J&P Enterprise out of Dodge City came to install new cameras throughout the hospital. They took it upon themselves to purchase gifts for our residents, which included socks, shoes, cologne, perfume, deodorants, candy, and pajamas. Not only did they purchase gifts for our residents, but also for LTCU staff. Thank you, Joan, Pat, and Travis. We truly appreciate it. So some people came to install the cameras in the hospital and saw a chance to bring kindness and generosity and light into the world, and they did it. And it really stands out in times like this. So just really cool that they did that. Mary, thanks for getting that story to us. Want to just wish everybody a happy holiday again. Every week, Tuesday at 4:00, we'll be here to talk about the Southwest region. Sign up if you want to get it via email, spread the word, and we're grateful. We hope you all have a very happy holiday season, and we'll see you this time next week. Thank you, everybody, for making time to be on this call.
Merry Christmas, everyone.